Rheumatoid arthritis is an autoimmune condition characterized by chronic inflammation of the joints.
The synovium becomes inflamed in rheumatoid arthritis, causing synovitis. The chronic inflammation of the joint will lead to the erosion of the joint over time. Unfortunately, the cause of rheumatoid arthritis is currently unknown. However, it's commonly thought that a combination of genetic affinity and environmental factors may contribute to an individual's likelihood of contracting the disease.
According to Ruffing and Bingham from 2018, often smaller joints such as the metacarpophalangeal and the proximal interphalangeal joints are first affected. Early symptoms include pain or stiffness in these joints with asymmetrical presentation. As the disease progresses, joints may become deformed. The pain may worsen, and other organs such as the muscles, lungs, and blood vessels may also become affected. At homeostasis, a synovial joint consists of a synovial membrane that lines the joint capsule and produces synovial fluid. Synovial fluid acts as a lubricant, and along with the articular cartilages that cover the articular surfaces of each bone, it reduces friction during movement.
There are many different cell types integral to the homeostasis of the joint. However, there are two main players. These are the macrophages who enfold and destroy pathogens, and fibroblasts who produce the extracellular matrix, which makes them important to the integrity of the cartilage and lubrication of the joint. In a healthy joint, macrophages not only enfold and destroy pathogens, but they also have an important role in the inflammatory response because they help to maintain sterile inflammation by containing cells that are already in the process of dying. Fibroblasts like synoviocytes are also present in the synovial fluid and are responsible for the production of the extracellular matrix, and hence are important to the integrity of the cartilage maintenance and lubrication of the joint.
With rheumatoid arthritis, homeostasis becomes disturbed as various immune cells, such as the aforementioned macrophages, become overactive, hence triggering a range of reaction pathways that result in inflammation, bone and cartilage erosion, and extensive angiogenesis.
There are many cells that perform a role in pathogenesis of rheumatoid arthritis, including macrophages, fibroblasts like synoviocytes, as well as some other immune cells such as T cells, plasma cells, and neutrophils. As outlined in the previous section, macrophages are important in sterile inflammation of the joint. However, they also contribute to rheumatoid arthritis through their secretion of cytokines, which are small proteins who are crucial to controlling the growth and activity of other immune cells. Cytokines such as tumor necrosis factor alpha, interleukin-1, and interleukin-6, which encourage inflammation of the synovium. The aforementioned cytokines also stimulate the fibroblasts-like synoviocytes, which makes them proliferate and also stimulates rank L expression, which is the signaling that regulates osteoclast formation. The stimulation of rank L expression with the cytokines secreted by the macrophages stimulates osteoclast activity, which is what causes bone erosion. The stimulation of the fibroblasts-like synoviocytes also results in the creation of proteases, which cause cartilage degradation, and as the cartilage degrades, it also secretes more proteases, effectively creating a feedback loop as the cartilage continues to degrade. T cells also promote inflammation and secrete the cytokine interleukin-17, which is responsible for the promotion of macrophage activity and the stimulation of fibroblasts like synoviocytes, and therefore have a role in the stimulation of rank L expression.
According to Volkov, Vanchi, and Vanderwood from 2020, the overactivity of these immune cells is thought to be triggered by autoantibodies, such as rheumatoid factor and various anti-modified protein antibodies, or AMPAs, including anti-citrulline, anti-carbamylated, and anti-acetylated protein antibodies. AMPAs are produced by B cells when certain proteins undergo mutations, with the most common mutation associated with rheumatoid arthritis being citrullination. This is when a protein's arginine residues become permanently modified into citrulline, resulting in them becoming recognized by the body as foreign. According to Dirksen, Wisinga, and Vanderwood from 2017, much like other antibodies, these autoantibodies may bind onto Fc receptors, stimulating the release of tumor necrosis factor, which results in an inflammatory response. They may also contribute to bone erosion by stimulating the proliferation of osteoclasts. According to Takeuchi from 2017, biologics are one of the current treatments available for rheumatoid arthritis. These are medications that are extracted from living organisms or that contain a component of them. Biologics for rheumatoid arthritis include infliximab and tocilizumab, which target and inhibit cytokines associated with the inflammation that is characteristic of rheumatoid arthritis. Takeuchi further states that tumor necrosis factor alpha, or TNF-alpha, is the cytokine that is targeted by infliximab. Infliximab binds onto TNF-alpha molecules to prevent them from binding with other molecules, thereby inhibiting their activity. Tocilizumab, however, according to Shepard et al. From 2017, targets interleukin-6 by blocking their receptors. This prevents interleukin-6 from being able to stimulate an inflammatory response. Hence, by inhibiting cytokines that contribute to inflammation, these drugs can help to alleviate the joint pain and deterioration that may result from chronic inflammation.
Although the inhibition of the inflammation-stimulating cytokines is important in controlling the disease, it's important to acknowledge that interleukin inhibitors may increase the risk of infection in patients, and hence it's recommended that patients are checked every 4 to 8 weeks for side effects. In some cases, steroids such as prednisone are also used to provide quick relief from symptoms. However, they're only recommended for short-term relief and not for long-term use, as they may have serious side effects when used for prolonged periods.
This research illustrates the autoimmune nature of rheumatoid arthritis, meaning that the immune system attacks the body's own cells as they become recognized as foreign due to certain mutations. Current treatments target only specific pathways of the immune response in order to manage specific symptoms of the disease. However, there is still a lack of viable treatments that target the entirety of the disease's pathophysiology.